Hi there. So I recently saw a video diary of a friend that was about her cancer medications. And it got me to thinking that maybe I should do one with all my heart medications, especially considering I'm coming on the year anniversary of my heart attack. And my son is right now collecting for Jump Rope for Heart. And so this morning I had to fill my my week's worth of meds, and as I was doing that, I figured it was a good time to film this. This right here is my trusty sorter for my week. As you can see, I take a considerable amount of medications, and without this, I think I would be kind of lost. I like having it sorted for me, especially so I don't have to take the time to do it every day. In the mornings, I get up really early for work, and I really don't want to have to face sorting meds at that time. I really don't enjoy doing it at any time, to be honest. The very first time I had to do this was probably the first realization of what I had been through and what I was looking forward to in my life. The first time I did this, the realization really hit me. And it reminded me so much of my dad, and so it was really hard. For those that don't know, my heart attack was April 1st, April Fool's Day, and I had lost my dad January 19th of the same year. So it was very soon after, and it was difficult, to say the least. Anyway, so I take several medications, and most of them are for my heart. There are a few that are not, and I will include those anyway. These two are for ulcer and reflux. I have Nexium and Sucralfate, which I take the Nexium daily and the Sucralfate twice a day. Even the Nexium on its own was just not enough for my ulcer. I was in extreme pain, and they added the Sucralfate to coat the lining of my stomach before meals, and that helps quite a bit. These meds are mostly the cardiac meds, if not all. Obviously, there's the aspirin. I take the aspirin every morning, full dosage, one aspirin. Lots of people are on baby aspirin for some reason. I'm not. I'm still taking the full dose. Effient, which is my anticoagulant blood thinner. That is to keep my stents open and the blood flowing through them. This is my statin, which is the generic for Lipitor. And I cut these in half. So even though these are 40 milligram tablets, I take 20 milligrams a day. The full 40 was giving me awful cramping in my legs. I couldn't exercise with it. I literally couldn't move the pedals of the bike when I was taking the full 40. And cutting it down to the half made that considerably better. This is not a heart medication. This is Paxil, and that's for depression. Unfortunately, when they put me on it, they gave me no indication or no explanation that it's very difficult to come off of Paxil. It's very dangerous to come off of Paxil. I am now finding that out on my own. Unfortunately, I probably could be on this medication for the rest of my life because it is really, really dangerous to stop. It's important for people to know. Metoprolol is, I always get lisinopril and metoprolol confused. One of them is one of them is the beta blocker, and the other one is the, I can't think of what it's called. I'm sorry. But anyway, metoprolol and lisinopril. I take the metoprolol at night, the lisinopril during the day. They help with blood pressure and other cardiac symptoms. Ranexa is an overall cardiac drug to help with those things as well. I take one of those in the morning, one at night. And Vascepa, which is the giant gel caps that you see here. Vascepa, I take 2 morning, 2 at night. Those are for triglycerides. It's like taking fish oil or those Omega Red or those different fish oil, omega-3 fatty acid type things. But these are prescription. And so they're also very expensive because it's a new drug, and as are several of mine, unfortunately. My Effient is not commonly used, my Vascepa is not commonly used, and neither is the Ranexa. And so my drugs monthly are quite pricey. Luckily, I have found some discount programs online, and those help me a little bit. And occasionally you can find, like, if you start a new drug, the first prescription of the drug is discounted or something like that. But for the most part, my drugs, if I were paying per month, are probably around $200 a month, if not more. Probably more, but I'm doing 3 months at a time and I space it out. For instance, right now I am due for Nexium. I have no Nexium, and I can't afford to pick it up, to be honest, but I will next week. And those are my meds. The reason I'm doing this is primarily because I think there are a lot of women out there who truly don't understand that this can happen to them, or they don't expect it to happen to them. And if anyone should have, I should have, and I think I did all my life. I realized that I would one day be in this situation, but I didn't want to admit it. My genetics are pretty poor, obviously. So I think that I probably should have known and did know, but it's hard to admit to yourself, and especially when you're going through stuff with a family member and that's taking the primary focus of your attention. It's very hard for women to put themselves first, and it's something that you have to do, and you have to be aware of your health, and you have to know what your history is and your risk factors, because ultimately, if you don't put yourself first, then you won't be around for those that need you so desperately. And if you really are wanting to put them first, putting yourself and your health first is really what you need to do. So hopefully some people that are going through this will be able to relate and appreciate it. Those that don't relate or don't get it yet, maybe they will. But I guess I'm doing this because it's healing for me, and I want people to know what I do on a daily basis, and that's that. I forgot to say, this is my pill cutter for the Lipitor. This is how I cut it every night, or every week when I'm loading my sorter. That's it's really useful. I was trying to break them myself, and my hands were hurting desperately from breaking them. It was painful to my hands. So I got this, and it really helps. Alrighty. So, happy anniversary to me. I'm alive, and that's what counts.